Hey everyone. So I'm sure you've seen the headlines about this new virus outbreak happening in China, and you're probably thinking, wait a minute, haven't we been through enough with COVID-19? We hear yeah. And that's exactly why we're going to take a deep dive into what's really going on with this HMPV thing and, sort through all the noise and try to understand what's real and what might be a little bit of hype.
It's really interesting because HMPV,
Hmm.
it's not actually a new virus. It's been around for ages. I mean, we've known about it for decades. And it usually just causes, mild cold-like
Uh,
symptoms.
Okay, so we're talking like the sniffles, a little cough here and there, just your typical annoying winter cold, right? That kind of you just expect to deal with every year.
Yeah, pretty much.
Yeah.
But here's the thing. This time, it seems to be a little more than just a few sniffles. We're seeing reports of hospitals in China, especially children's wards, getting absolutely slammed with cases, way more than what they would normally see during the winter months. I mean, they're even putting emergency measures in place to try and cope with the sheer number of patients.
Wow. Okay, so this is definitely sounding like more than just your run-of-the-mill seasonal cold. And the news articles we've been looking at, they're painting a pretty intense picture too. Photos of like packed waiting rooms, people wearing masks. I mean, it's kind of hard not to get those flashbacks to the early days of COVID, right?
Yeah, I mean, I get it. It makes sense why people are drawing those parallels. And it's actually pretty fascinating how, going through something like the pandemic, it's kind of shaped how we react to anything like this now, right?
Totally.
We're seeing countries like Cambodia, they're super on edge about all this. They're urging their citizens to be super cautious and even drawing comparisons between, the symptoms of HMPV and what we saw with COVID and even the flu.
Yeah, and we're seeing those reports coming out of Hong Kong too, right?
Yeah.
They're dealing with more cases, so it's clearly spreading. But then you've got the Chinese officials saying, like, hey, everything's fine. This is all under control, just a normal winter spike. They're even saying, like, travel to China is totally safe right now, no worries.
Yeah, it's almost like we're getting these two totally different stories. And
Yeah.
that makes it so much harder to figure out what we should actually be paying attention to.
Right. Like, is this just a temporary blip, or is this something, like, actually serious that we should be genuinely worried about?
Yeah.
Okay, so before we get too far ahead of ourselves, let's back up for a sec. What exactly is HMPV? You mentioned it's a respiratory virus, but what does that actually mean for like the average person who catches it?
Sure. So the symptoms, they're pretty much what you'd expect with a cold or the flu. We're talking coughing, maybe a fever, runny nose, that sort of thing.
Okay, so the usual suspects, the things we kind of just power through every winter, right? But I'm guessing there's a little more to it than just grabbing some cough drops and hoping for the best.
You're right. I mean, HMPV it usually is pretty mild. It usually goes away on its own after a few days. But there are a few things that make it a little trickier. Like for most healthy adults, it's really not a big deal. But for certain people, it can get kind of rough.
Okay, that makes sense. So when we hear vulnerable populations, who are we actually talking about here?
Well, we're mainly talking about babies. Their immune systems are still developing. And then the elderly, they might not be as strong at fighting things off. And then really anyone whose immune system isn't working at 100%. For those folks, HMPV can sometimes lead to things like bronchitis or even pneumonia.
Right, so that's definitely something to watch out for. And I think one of the articles mentioned that there isn't really a specific treatment for HMPV or a vaccine.
Mm.
So, what can people do to protect themselves, especially, the folks who are more at risk?
That's a really important point, since there's no like magic bullet for it. The biggest thing is just managing the symptoms and trying to stay as comfortable as possible while your body fights it off. Rest, fluids, over-the-counter stuff for fever and cough, the usual drill.
Right, good old-fashioned remedies. But it sounds like those basic hygiene things we all got so used to during COVID, those are still our best bet for prevention, right?
Oh, absolutely. Washing our hands like it's nobody's business, covering those coughs and sneezes, and just staying home when we're feeling under the weather. I know it sounds simple, but it makes a huge difference in stopping the spread of any respiratory bug, not just HMPV.
Okay, so we've got the HMPV basics down and the general advice on how to stay healthy. But let's circle back to what's happening in China. These news articles, they're really painting a pretty alarming picture. I mean, they're talking about hospitals being totally overwhelmed and emergency measures going into effect. It's kind of unsettling to see this happening, not too long after the whole COVID pandemic.
Yeah, it definitely raises a lot of questions and concerns. And I think it's important to acknowledge the psychological impact of all this. After everything we've been through with a global health crisis, any news about a virus, even one that's usually pretty mild, it can just trigger that anxiety and fear.
Totally. It's like our internal alarm bells are on high alert for anything that even remotely resembles another outbreak.
Exactly.
But as we're all trying to sift through this information and figure out what's actually going on, it seems like we're getting a lot of conflicting messages too.
You're right. We've got Chinese officials saying everything's fine, it's under control, but then you have other countries like Cambodia getting really worried and issuing travel warnings. And even within China, it seems like there's this disconnect between what the government's saying and what people are actually experiencing on the ground.
Yeah, and the article even talks about people sharing their experiences on social media, photos of packed hospitals, stories about having trouble finding medicine. It's like a completely different picture than what the official statements are saying.
And that difference, it just creates this sense of like mistrust and uncertainty.
Yeah,
It makes people wonder if they're getting the whole story, if something's being hidden.
it's giving me serious deja vu, like those early days of the COVID pandemic where information was scarce and nobody knew what was really happening.
It's almost like we're reliving those early days of like confusion and anxiety, but with a different virus this time.
Right, but this time we've got the baggage of the pandemic experience. Like we know how quickly things can get out of control, how misinformation can spread, and how fear can drive people to make decisions that don't really make sense.
It's like we're all carrying that weight with us now,
Hmm.
and it's shaping how we see this HMPV outbreak.
Hmm.
We're more aware, more cautious, but also maybe more prone to that anxiety and fear.
So where do we go from here? How do we make sense of all this information, these different perspectives, and this feeling of unease that's kind of hanging over everything?
Well, that's something we're going to dig into a lot more in the next part of our deep dive.
You know, one thing that really sticks out to me with this whole HMPV thing is that there's no specific treatment or vaccine for it. We talked about it earlier, but it's kind of a big deal, right? I mean,
Yeah.
it adds this whole other layer of complexity to how we deal with this outbreak. It's true. It's kind of wild, right? Like during COVID, we saw how fast science could move to create those vaccines and treatments. But with HMPV, it seems like we're way behind.
Yeah, it's true. HMPV's been around for a while, but the research on vaccines and treatments, it hasn't really been a top priority. It's only recently, with all the advancements in that mRNA technology from the COVID vaccines,
Hmm.
that we've seen a resurgence in interest for an HMPV vaccine.
So there's some hope on the horizon then.
Oh yeah, definitely. There are a bunch of research groups looking into different ways to make an HMPV vaccine, even using that same mRNA tech that works so well for the COVID vaccines. And there's also research going on for antiviral meds that could specifically target HMPV.
Okay, well, that's good news at least. But until those breakthroughs actually happen, we're stuck dealing with this outbreak using the tools we already have. And that brings us back to those good old hygiene practices.
It might sound like a broken record, but it's so important. Those simple things, washing our hands, covering coughs, staying home when we're sick, those are our best weapons right now.
And it's not just about protecting ourselves, right? It's about protecting those people who are more likely to have a rough time if they catch HMPV.
Exactly. It's about taking care of each other, you know,
Hmm.
recognizing that what we do affects other people, especially those who are more vulnerable to this virus.
This is making me think about the COVID pandemic again. It's hard not to, right? We saw how quickly things could go sideways, how misinformation could spread like wildfire, and how fear could lead people to make some pretty questionable choices.
It's like we all went through this collective trauma, and we're still dealing with the after effects. And this HMPV outbreak, it's kind of stirring up those old anxieties, making people more cautious, even scared. We might even see people going back to things like wearing masks and social distancing, even if it's not officially recommended.
Yeah, it makes you wonder, how is this whole thing going to change the way we think about public health in the future? Will it make us more proactive, more prepared for the next potential pandemic? Or will it just lead to this like pandemic fatigue where people are just exhausted and don't want to deal with it anymore?
That's the big question, isn't it? And I honestly don't think there's a clear answer. It could go either way. It could be a wake-up call, a reminder that we need to invest in public health systems, disease monitoring, and global cooperation.
Yeah, like a never again moment where we learn from our mistakes and come out stronger on the other side.
Exactly. But it's also possible that we could see the opposite happen. People might get desensitized to these threats or just resist anything that disrupts their lives.
Right, it's like walking this tightrope between being cautious and being totally burnt out. How do we find that balance where we're prepared, but not letting fear take over?
I think the first step is just acknowledging how complicated this all is. There are no easy answers, no one-size-fits-all solutions. We've got to look at this with a nuanced perspective, taking into account all the different aspects, scientific, economic, social, psychological, everything.
And we have to be able to adapt, to change our approach as new information comes in. We can't get stuck in one way of thinking.
Absolutely. This HMPV outbreak, it's testing us, not just physically, but mentally and emotionally, too. It's a test of our ability to adapt, to learn, and to move forward together.
So as we keep trying to make sense of this HMPV outbreak, we need to be vigilant but also discerning. Stay informed, but be critical of the information you come across.
And remember that we're not powerless in all of this. We can take steps to protect ourselves and our communities, even with all this uncertainty.
Okay, so we've talked about the virus itself, the fact that we don't have any specific treatments or vaccines, how important those basic hygiene practices are, and how to navigate all the information out there. But there's another piece of this puzzle we haven't really talked about yet, the global impact of this HMPV outbreak.
You're right. This isn't just a story about a virus in China. It's a story about how connected we all are globally, how a health crisis in one part of the world can quickly affect everyone else.
And that's exactly what we're going to explore in the last part of our deep dive. We're going to talk about the potential ripple effects of this HMPV outbreak on a global scale, what it means for the future of public health, and what we can learn from all of this. Okay, so we've really dug into this whole HMPV thing, learned about the virus, what's going on in China, and how to, make sense of all the info that's flying around. But now I kind of want to zoom out a bit, think big picture. What could this outbreak actually mean for the rest of the world?
Yeah, that's where things get really interesting. I mean, think about it. We're living in a world that's totally interconnected, right?
Yeah.
What happens in one place definitely doesn't stay there. Look at Cambodia and Hong Kong. They're already ramping up their monitoring and putting out those travel warnings. So yeah, this HMPV surge, it's already having a global impact.
And it's not just about the virus spreading either, right? What about the economic side of things? Remember how those COVID travel restrictions totally messed with global supply chains and all that?
Oh yeah, for sure. Even if HMPV doesn't cause that same level of disruption, I mean, we could definitely see some economic fallout. Think about increased healthcare costs, potential travel hiccups, maybe even some businesses taking a hit if people are hesitant to travel or go to big events.
Right, right. And then there's that whole psychological aspect we talked about before. I mean, after going through a whole pandemic, people are understandably a little jumpy about any new virus popping up.
It's true. It's almost like we all went through this collective trauma and we're still figuring out how to deal with it.
Mm.
So yeah, this HMPV thing, it could definitely make those anxieties worse, make people more careful, maybe even a little scared. We might see people going back to those pandemic habits, like masking up and social distancing, even if nobody's telling them to.
Makes you think, how is this all going to affect how we approach public health in the future? Are we going to be more on top of things, more prepared for the next potential threat? Or are we all just going to be so tired of it all, like pandemic burnout, that it'll be even harder to get people on board with doing what needs to be done?
Honestly, that's the million-dollar question. And I don't think there's an easy answer. It could really go either way. On the one hand, this could be like a giant wake-up call,
Yeah.
reminding us that we got to invest in public health stuff, like better systems for tracking diseases and more global cooperation.
Right, like a never again kind of thing where we learn from what happened and come out stronger because of it.
Exactly. But then again, the opposite could happen too. People might just tune it all out, get desensitized to these threats, or push back against anything that disrupts their lives.
It's like we're trying to find this balance between staying aware and not getting completely overwhelmed by it all.
Uh,
How do we hit that sweet spot where we're prepared but not frozen by fear?
I think it starts by understanding that this is a really complex situation.
Hmm.
There aren't any simple solutions.
Yeah.
You know what I mean? We got to approach it with a more nuanced view. Look at all the different factors, the science part, the economics, the social aspects, the psychology, the whole shebang.
And we have to be flexible too,
Yeah.
ready to change course as new information comes out. We can't get stuck in just one way of thinking about it.
Totally. This HMPV thing, it's putting us to the test, not just physically, but mentally and emotionally too.
Yeah.
It's about how we adapt, learn, and yeah, how we move forward together as a global community.
So as we wrap up this deep dive, what's the one thing you really want our listeners to take away from all this?
I'd say the most important thing is to stay curious. Don't let fear shut down your brain,
Mm-hmm.
Keep asking questions, keep looking for reliable information, and keep talking about it.
I love that because in the end, knowledge is power, right? The more we understand about the challenges we're facing, the better prepared we'll be to deal with them and hopefully create a healthier future for everyone.
Well said.
And on that note, I think it's time for us to say goodbye. Thanks for joining us for this deep dive into HMPV. Until next time, stay curious, stay informed, and stay well.
And keep diving deep.